G'day, it's Tim here. Here with Natasha Mound from Zurich Insurance. G'day, Natasha.
Hi, Tim.
How are you going?
Good.
Natasha's here today to chat to us about a really interesting piece of research that Zurich have undertaken, and that's called the Zurich Cost of Care White Paper. Natasha, what is the white paper and how has it been put together?
Yeah, okay. So Zurich collaborated with Oxford University's Smith School of Enterprise in putting together a stack of really important research to help financial advisors and their clients understand the true financial impact of significant medical conditions or injuries.
Because I think when we do our research on what type of cover and what levels of cover are needed, the conditions that people have where they're still living with become very grey because certain conditions need different levels of cover, don't they? So we know there are some main things that people do claim on, the big ones like cancer, heart attack, stroke, those types of things. So what did the paper uncover? Sort of costs related to those?
Yeah, okay, so if we look at cancer to start with, so the average cost or burden is about $126,000. Okay?
Right,
that's a lifetime cost. And there are other little things in the cancer piece, such as the cost of perhaps new or non-PBS listed medication, which can cost someone over $5,000 a month. If we look at heart attack and strokes, that cardiovascular piece, the actual cost associated with those medical conditions themselves is actually quite low because Medicare actually does come to the party quite a bit on those.
Right.
However, there is an impact to carers, particularly for people who are impacted by a stroke, so they've got some disability. So a carer, could spend 40 hours a week, their own income is reduced, they incur more expenses, so there's an impact there.
The back-related one was interesting too, I think you mentioned.
Yeah, so with backs, so back conditions and arthritis account for 40% of forced retirements. People exiting the workforce.
Certainly consistent with what we see.
Yeah.
In terms of the thing that I'm always interested in with this as well is we get a lot of clients that might say to us, I thought my Medicare probably would cover a fair bit of that, but that's sometimes true and sometimes not true depending on the circumstance, isn't it?
Yeah. So what we found in the research was individuals, so us, we are the third biggest contributors to health expenditure behind federal and state governments. We spend twice as much as what our private health providers spend on medical conditions. So, and if we look at the National Disability Insurance Scheme, we know that they are actually supporting, so the government from that perspective is supporting approximately 46,000 individuals.
Yeah.
But we know that there are more than 4.2 million Australians actually living with a disability.
Right.
So you're in for a pretty nasty surprise, I think, if you're relying on the government, private health to support you when something happens. Yeah,
so look, it's really just to give you an insight as to some of the research that we do undertake when assessing the insurance needs of our clients. We know that none of us want to overpay for insurance, but we also don't want to leave ourselves exposed. So a paper such as this has just been really valuable. So thanks Natasha for coming in, and
Thanks, Tim.
we'll see you soon.